Imagine this. A 42-year-old parent goes to urgent care with vague abdominal pain and nausea. They're sent home with antacids and told to follow up. 2 days later, it's a ruptured appendix. That small gap changed everything. I'm Jess, a family nurse practitioner and legal nurse consultant. This is the space where healthcare, law, and real-life situations intersect. Let's separate medical fact from fiction. Quick note before we dive in, this episode is education, not personalized medical or legal advice. If you're worried about a specific case, reach out to your clinician or a legal professional. Here's the short version. Most diagnostic misses come from a few predictable sources: how humans think, how systems are built, and how we communicate. Cognitive shortcuts are normal. Our brains simplify to make decisions fast, but that speed can mislead. Take anchoring. A clinician seizes an early idea, maybe UTI or stress, and then filters new facts to fit it. Or availability bias. After seeing several migraines, the next headache is more likely to be called a migraine. Those aren't laziness. They're human, but they change what gets noticed. I see this on shifts. It's subtle until someone speaks up. That matters. System problems amplify those human limits. Short visits, fragmented records, handoffs between teams all create opportunities for clues to get lost. So what can you control? Not every system failure, but how your information is presented and how you ask for care. Small changes there make a big difference. Warning sign. Symptoms that are getting worse, but the plan doesn't change. If pain is escalating over hours or days and the clinician says, "Come back if it's worse," without specific return instructions, that's a red flag. Ask, what exact changes should make me come back or go to the ER? Warning sign. A timeline that doesn't match the explanation. If symptoms began suddenly or very severely, and you're told it's a chronic condition that develops slowly, pause. Say, "My symptoms started suddenly and are severe. Could this be an acute process that needs imaging or observation?" Warning sign. The exam doesn't match the complaint. If you report severe pain, but the note says comfortable appearing, without explanation, ask, "What did you find on exam that explains the pain level I reported?" That reconciliation often reveals whether further testing is needed. Warning sign. Multiple clinicians giving different explanations with no one owning the plan. If urgent care says one thing, the ER another, and your primary care clinician gives a third interpretation, summarize, "Here's what each place told me. My main concern is X. Which of these best fits your assessment? And who will follow up?" That helps turn scattered pieces into a single plan. Warning sign. Repeated visits for the same unresolved complaint. If you've returned multiple times and the diagnosis hasn't changed, ask for a different approach: imaging, labs, or a specialist referral. Try, "I appreciate your help, but my symptoms persist despite treatment. Can we consider imaging or a specialist's opinion to rule out other causes?" Now, practical actions you can use right away. First, document. Keep a short symptom log. Date, time, onset, what made it worse or better, exact pain level, and new symptoms. Use a template like day/time, symptom, severity 1 to 10, what I ate/took, better/worse. Bring it or message it to the clinic. Second, lead with the 3-part opener: problem, timeline, concern. Say, "I'm here because X started Y days ago and has gotten Z worse. My main concern is A." Short, focused, effective. Third, ask focused diagnostic questions. Examples: do my symptoms warrant imaging today? What are the top 2 diagnoses you're considering, and what would make you change your mind? Or, if this gets worse, what specific signs should send me to the ER? Those move the visit from vague reassurance to concrete thresholds. If you feel dismissed, use a respectful but firm line. "I appreciate your assessment. I'm still worried because X, Y, and Z are happening. Would you consider imaging or a specialist review to be safe? It keeps the relationship cooperative while making your concern clear. I once had a patient who'd been told it was just stress twice until they brought a simple timeline that showed a clear change. That timeline changed the whole plan. Small prep, big impact. When to escalate. If symptoms worsen quickly, or you notice new neurological signs like slurred speech, weakness, loss of function, high fevers, or sudden severe pain, don't wait. Ask, based on my symptoms, do you recommend urgent imaging or transfer to the ED? If you're still concerned, get a second opinion or go to the emergency department and document that you requested escalation, time, and who you spoke with. A few small documentation habits that help later. Ask for a copy of your visit note, message a concise summary to the clinician after the visit, and log calls with times and names. Those notes are often the clearest record of what happened. Curious? Let's pull this together. 3 essential takeaways you can use immediately. 1. Track and present a concise timeline and the most important symptoms up front. 2. Use targeted questions that force concrete decisions. Imaging, referral, specific return precautions. 3. Escalate when the picture changes rapidly or repeated visits don't resolve the concern. Those 3 moves make it far more likely clinicians will notice the right clues. Quick checklist you can screenshot. 1. One-line opener with problem, timeline, concern. 2. Symptom log with timestamps. Ask, what are the top 2 diagnoses you're considering? Ask, do I need imaging today? Ask for specific red flag return instructions. If this episode helped, there's a downloadable checklist and sample scripts in the show notes you can copy for your next appointment. Most clinicians want to help. These strategies make collaboration easier, not confrontational. Thank you for listening. If today's episode helped clarify a medical or legal issue, or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, a family nurse practitioner and legal nurse consultant, and I work with attorneys, organizations, and professionals who need clear medical insight in complex cases. You can learn more or schedule a consultation at faqbynursejessconsulting.com. If you found this episode valuable, please share it, subscribe, and leave a review. It helps this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.